Hello, everyone. This is the first AMCI mini moment. All right, what is a mini moment? A mini moment is an opportunity for me, Mrs. J, to discuss one topic. The topic that I want to discuss is yesterday's YT question. All right, last Thursday, we discussed a scenario where I provided you with the wrong answer. So let's review it. A patient is having ongoing back and hip pain. The physician elects to perform a sacroiliac injection at an ambulatory surgery center. After sterile prep, the patient is placed prone and under fluoroscopic guidance. The needle is placed into the SI joint, that's the sacroiliac joint, with a mixture of 20 milligrams of celestone and marcaine for pain relief. Code the procedures. All right, coders, you should pause the presentation to solve. If you said D 27096, you are correct. The incorrect response given yesterday was A, where we instructed you to code additionally the fluoroscopic guidance. So the code 29096 says injection procedure for sacroiliac joint, keyword, anesthetic steroid with image guidance, keyword, it's bundled in there, including arthrography when performed. So this was the correct code, and if you looked at the parenthetical notes, 27096 is to be used only with CT or fluoroscopic imaging, so we knew that was correct. And then if you went over to the 77003, it told you you can't code it with 27096. All right, so Mrs. J made a blunder, and this probably the reason why she made this. I wonder why Mrs. J made that blunder. Okay, here's why. All right, the coding guideline changed. Yes, Mrs. J has been coding for a very long time, and she did something that she advises all students not to do. All right, so the coding guideline changed in 1/1/2012. Although I've been coding for a very, very long time, and I've been using the CPT manual for years. Too long for me to say. But even though the answer was incorrect that was furnished by another source, it was my job as a coder to make sure I selected the correct answer and provide you with the correct answer. And do you know what I did? See these 4 or 5 reminders at the top of this Jeopardy game? If the doctor didn't say it, it didn't happen. Code what you see. Study smarter, not harder. Keep it simple. Overthinking is not okay. All right, which one did Mrs. J do? Which did she violate? She violated code what you see. While I read the scenario, I read the code language, I didn't code what I saw, I code what I thought because I knew that guideline. I knew that guideline very well, and I applied what I thought, and I thought the guideline was the old guideline, even though I was reading and seeing the correct. All right, one thing you have to take from this: do not do what I did. always code what you see. I think there is another lesson that we learn too. Always use the most updated manuals, because the guideline that I was thinking about was from 2012. All right, so we see it's 2016. It has changed. So, two things: code what you see and use the correct year manual. And that was the AMCI mini moment by Mrs. J. Thank you.